Humana and Cano Health want to remind the community how important it is to maintain a positive patient and primary care provider relationship. Here's Rocky with more.
You guys are working together to help people understand, how to have a better relationship with their primary care physicians now, right?
Yes, exactly.
So Sarah, let's start with you. What exactly is a primary care provider, and how do you maintain a positive relationship with them?
It's a great question. So your primary care provider, or also known as a PCP, really think of them as your home base. So they're the person that you go to first with any preventative screenings, any medical illnesses that might come up, non-urgencies, things that will keep you healthy. And then they're also going to be that point person to give you any referrals that are needed to get you out to a specialist when needed. You should feel comfortable when you're talking with your provider. When you come into any of the Cano offices, we really like to focus on serving our patients in their preferred language, understanding their culture. So if you are a Spanish speaker, Tagalog speaker, many others, we have a full staff, including providers, that can work with you and understand some of those cultural differences as well as the language barrier that might exist. So that's one way to tell. And then also we want to make sure that you're comfortable in getting the information you need with medication refills, with your referrals, that you know that you're being taken care of. And if you don't feel that way when you're talking with your doctor, it's a good time to assess that relationship and see if it's the right fit for you.
Perfect. And Rachel, I'm going to have you chime in here now. For our viewers who are actually enrolled in Medicare, how should they start that?
It's important to express your intentions. Make it clear that you want to be an equal participant in the decision-making process. And when it comes to making the most of your visits, there are certainly things you can do to ensure that your visits go smoothly. Here's my checkup checklist. First, review your family health history ahead of your appointment. Have your close relatives experienced any new conditions or diseases since your last visit? Second, write down a list of issues and questions to take with you. Have you noticed any body changes, pain, or fatigue? Have your eating or sleeping habits changed? Are you taking your medications as directed? Be honest with yourself and your primary care provider. And finally, when you're at your appointment, discuss your future. Review any scheduled treatments for recent lifestyle changes so you can help make more informed decisions about your health care plan. Write down notes so you can keep your doctor's advice at hand once you get back home. And if you do these things, you'll likely not only impress your provider, you may improve your likelihood of getting the care that best meets your needs.
Wow, thorough answer.
I know, right?
Thank you, Rachel. And Sarah, for you, any last words for our viewers that want to know more about Humana and just how to take care of themselves overall?
I'll add this. At Humana, we not only care for our Medicare Advantage members, we care about them too. This is the heart of our whole person healthcare philosophy and value-based care model that many of our network providers participate in. Primary care providers with a value-based care arrangement in our network are rewarded for care that leads to better health and a better experience for our patients, not just the number of patients they see and the procedures they order.
Give Humana a call at 1-800-345-8017 or visit them online at healththatcares.com.